Hello, everybody. Welcome to your favorite prescriptions with Dr. Ambika Nair. Dr. Ambika Nair is a very renowned doctor here in the tri-state and across the globe. Her prescriptions, her home remedies, and her comforting words give us complete hope in the program Aware and Care. Let's welcome Dr. Ambika Nair first from Santhigram Group of Companies. Namaskaram, Doctor.
Namaskaram. How are you?
I'm doing good, Doctor. Thank you so much. Winter is here, lots of pains, aches. But there's a topic that many of our viewers have been asking about, and I was a little confused because the term has been used with varied body parts. So today we'll talk about cervical dystonia, though I hear that dystonia has different versions of it. So please explain to our viewers what exactly is dystonia and what is cervical dystonia.
Cervical dystonia means that is the neck pain. You understand? So it's not a normal neck pain. You know, it is characterized by long lasting. You know, it can be chronic. So involuntary, repetitive. Like today morning you get up, you don't feel like you're like one side. Whether it is lateral or any side, it is like twisted like this, very painful. You can't even move. Okay, so like it is only involving with the neck muscles actually.
Neck muscles.
It's a very spasmodic, like it is called a torticollis also. So, controlled by the genetic mutation also can be there, stress also, emotions also, depression, anything can happen, whether it can be injury also.
Okay. So, but this, when you say it's pain related, is there a particular portion of the neck that pains, back side, front side, shoulder side, or is it twitching or, jerking? How is it different from any other
no, it all depends upon the cases. Actually, some people will have like nodding of the head, like some people, they can't even move their, see, like one side it will go like involuntary to one side only.
Oh, okay.
Okay, so, like this it will go, and it is very difficult for the, if we do it also, it will go back to that. Involuntary, it will go back. Some people, like anterior side, like they will put the chin like this, they cannot move it. Some will be like lateral. It's very, like it all depends upon the cases actually, whether it is due to any injury or anything like that. Anterior means, they will have like, like a lateral side means they will have difficulty in swallowing also. Their speech also will be like involved. If you don't take care, it will affect whole, like your neck area. Some days, even your all hands, everything will be.
So
it will be difficult even for your cognitive power, also your memory, everything.
So this is a condition which develops with time or any particular gender? Because I see most people who texted us or send us messages were women. So is it more common in women?
Absolutely. It is mostly seen in the middle-aged women. Nowadays, because everybody is working with a computer also, so that also will be. I have like a handful of cases. I'm treating and they are doing very well actually.
Okay. But is this condition life-threatening, or what is the first sign of?
It is not that curable, like totally under illness, you take care also. Some people, just with the time they get cured, but some people, we have to live with that. But the severity, this is a Vata dosha in Ayurveda, Vata Prakopana. Okay, so this can be taken care when we do certain therapies and all, so that will be like. So you can see, like when the patient will come, we can see visibly on examination, like a swollen neck muscles will be there. They will have, some people will have severe headache, vomiting feeling will be there, spasmodic pain, like a continuously, it's like a sea wave which comes to the neck muscles, like then, like some people, they can't open their, it affects the jaw also. So they can't even open up, like chin and here, most is one shoulder, restricting movements will be there, head and neck. Some people, I have seen that lady, she was around 38-year-old. So, always in the computer system working. So she started like nodding continuously involuntary, but doing very well with the treatments.
So, but there was also one more question. A person had a message saying that their family, 2 members have Parkinson's. So she is very scared. She says she was asking to put this question forward, that is it also a sign of Parkinson or it's completely different?
But that has to be ruled out whether, like it is with some, actually in this case, diagnosis is very difficult. Because, see, they will only tell them, oh, little neck pain, nothing will happen. Or you have any, like cervical spondylitis or spondylosis or other. But when the rigidity is very severe and when you can, this has to be, like anybody who knows the cases, they will understand what type of, like whether it is dystonia or not. Okay.
That was a very good point mentioned, because until it is diagnosed, it is just feeling like a neck pain or, just a cramp or just an injury related pain. But Dr. Nair, does this come like a spasm in phases, or it is a long lasting, it comes for 1 week, or it comes on daily basis or specific time of the day? Somebody feels that the symptoms are more.
Some people will have only neck pain for some time, maybe like after 2, 3, 4 days or 2, 3 weeks, they become perfectly all right. But if it is not like, if it is persistingly coming and, like, see, few days back, I had a neck problem. Again, after like, it again recurrent will be there, So if it is coming like, then there is an issue. Then you have to take, get a look into the problem and you have to really see a doctor. And they will tell like, because it is like it is like this, they cannot move. So many cases comes to us like this. Sometimes stroke also, like even tumor. We have seen like tumor patients also. Exposure to certain drugs will be there. Even lead poisoning, carbon monoxide poisoning, like any infection. Sometimes so many severe infections will be there, or any head injury, even meningitis. Yeah. Some people will have little family history also.
Oh, that is also a possibility. Do you also see that in younger age groups these days, or it's definitely mostly
I have not seen in younger.
Okay,
Very younger group, I haven't seen that. Okay, yeah. Only something a little bit of like a neck pain and a stiff neck and all will be. But in ladies, I have seen. I have seen actually, yeah. Only one male I have seen. Rest all, like female. Maybe we work a lot with our neck muscles.
No, I think we also nod too much to everybody. No, okay.
Yeah. We don't want to trouble people.
Yes. Apart from the humor part of it, we are just trying to bring a lighter side and also let you know that certain conditions are just manageable, certain conditions are curable. And dystonia, if you're seeing the first symptoms of your neck pain, which is chronic, please immediately get a diagnosis so that the treatment is taken care of on a regular basis or immediate basis. Because like just Dr. Nair just mentioned, that it is sometimes a neglected pain that leads to severe conditions, which becomes very difficult to manage. Dr. Nair, dystonia by itself, like I said, we've received so many messages for different body parts. So do you think that we should be doing a different episode for different body parts?
I will do it because actually, like involuntary passing of urination, bedwetting and all, in elderly people, and I will do it. Okay. Whatever you say, I will give it.
Okay, so dystonia by itself is extremely painful condition, and today we are talking about cervical dystonia, most commonly seen in women and in middle age, and it is definitely manageable. And the first symptom, do not neglect. Now let's get to the next part of it as to with our lifestyle. Will it at any point be considered also as a lifestyle problem? It's only a muscle problem or a nerve problem?
The way you sleep.
Oh.
Okay. Some days, nowadays, or some that should be there. So you will be sleeping in different positions. So if you sleep in the same position for a long time, it will happen. Yeah.
Sleeping patterns, looking at the phone on the bed.
How many pillows you are using, whether you are really maintaining the good posture while you're working, that you have to show that, see that sitting properly, maintaining a good posture.
My question is very tiring right now because, you mentioning about all these things, this has become part of our life. People are doing viral videos about, how a 2-year-old or a 1-year-old has, ordered things on Amazon or is always on the phone or has become cranky. It has become part of our life, having this neck muscle constantly bending and looking at gadgets and not having to looking at the sky. I think very few of us are looking at the sky except for people who are into sports. Now let's try to understand how to manage this pain when it attacks, or whenever the phase comes. Is it a hot pack or a cold pack that will give comfort to the person with cervical dystonia?
Hot pack is good. Actually, if the swelling is there, you can alternate with the cold and hot pack. Okay, but it all depends upon the case actually. We have like a very good Panchakarma therapies also. So after the Nadi Pariksha, we'll see that of course it is from the Vata. Then, we do the nasal therapy, that is Panchakarma, and Nasyam is also there. Karna Purana will be given to them. Then Grivavasti is there. So we'll be putting a band on the neck area and we'll be doing that. Shirodhara, because they will be like so anxious and so depressive that they will, that is the end of life. You understand? That fear for any movement, anything like that, it's seen the case like that. That's what I'm telling. Yeah.
Doctor, in all the episodes of Aware and Care where we talked about pain, especially muscle or nerve related, you have been very specific about giving comfort information about use a hot pack or a cold pack. This is the first time you have said that it depends on the case, cold pack or hot pack. Can you put a little more light as to why you said that? Why would
If
it
the,
be
like if the pain is more, sometimes, some body type, okay, it will not work. Even like that's what, like if it is, it's okay that they can use cold pack.
So basically it also means that we have to let our viewers know that please do not try any home experiments just like that for cervical dystonia. For all you know that your heat packs could be damaging you more, or your cold packs, depending on
overuse of anything, Madhavi. Overuse of anything will actually see rubbing of, like so much of, muscular relax, and I have seen that. It all bend up and they bring over here, and their neck will be like this, very difficult. It does not move to the other part. When we take it, it will again come back. It will come back.
This is something, a revelation in this program, that these muscle relaxants could also create damage over the time, because for some people it is just an habit to put it at night before sleeping, and it could have a wear and tear effect. Dr. Nair, let's also understand some home remedies that could give a person comfort apart from, hot pack, cold pack.
Abhyangam, they can do it. They can take turmeric at home.
For the inflammation.
It is very good actually, but only problem, like in such cases, then there are, after the treatment, we ask them to do whatever they can do at home.
Okay.
So very bad cases only comes, Madhavi. They will not come just like that, because they will go everywhere, or their physical therapy, every damn thing, then only they will come to us. And even, like injections and all, they use it actually.
So friends, I think I definitely have to correct my question there by rather not asking doctor about home remedies or comfort factors for cervical dystonia, because this definitely needs a doctor's attention, and then the diagnosis or the therapies or the remedies would be suggested by the doctor, because it's a very sensitive portion of your body which definitely takes care of the rest of the body. So if you have a condition like this, or you feel that something is bothering you, immediately go to a doctor, get the diagnosis and get the treatment process followed. Now, doctors, if I have to really change my question, is it avoidable?
Yeah, it is avoidable if you take care a little bit.
No, avoidable. The condition is avoidable. Dystonia can be avoidable, prevented.
That's what I told. It can be if you take care of your neck from the beginning. Massaging yourself, doing a little bit of physical exercise. People don't do such things. Okay, very, very nicely it can be, preventable.
Okay, so that
has to be, especially while sleeping, that you have to, like sometimes when we travel in the flight itself, after the, like after the travel, we can see that it's because involuntary to goes to one, but that is not dystonia. That's only momentary thing.
Momentary thing. Okay.
Yeah, but like we had to, if it, that's what I do repeatedly, if it is coming, then only we see that there is a really problem with your neck.
In this program of Aware and Care, in today's episode of Cervical Dystonia, as I was asking Dr. Nair a couple of questions, there were a couple of questions which I was like, how is it possible? And I had so many more coming up. But then I also noticed that technology has its own hurdles to, get something miscommunicated. So that's exactly what happens when sometimes our viewers pick home remedies and try on them. We have again and again advised our viewers that please do not try the home remedies at their, or whatever you see, whether on YouTube or through somebody's consultation. And get to a doctor and get the information so that you hear it right, you understand it right, and you get treated right. So, Dr. Nair, in today's episode of Cervical Dystonia, any points that you want to mention to our viewers, because we're doing just capsules of these programs?
Yeah, oil massage is very good actually. Santhigram oil is very good. Maharaja Prasaranya, we all use like that. Even after the therapies, when they go home, we give them all these oils so that their circulation will be very good. And certain exercises like therapeutic yoga, what they should do, what diet they should follow, avoiding, like a very cold food and cooked food.
Mhm.
They can add ghee to their diet.
Mhm.
So many things we will be telling them, but don't follow whatever I'm telling now.
It is just an overview of
Yeah.
conditions and symptoms that can be cured at Shantigram and by any doctor of your choice. But the point is to rush to a doctor to get these conditions treated. Please like, share, and subscribe to the episodes, as on popular request, we are making capsules of it. And so that no information is misinterpreted and you do not take your chances at home. Thank you so much for today's episode, Dr. Nair. I look forward to more episodes and series on dystonia too with the Shantigram group of companies. Thank you.
Thank you so much.